we are indeed honored. आज हमारा बहुत सौभाग्य है that we are going to show you a daughter of India who was born in India, migrated to United States of America in Chicago. Her name is Rubina, got married to Dr. Paul, and she herself is a dentist by profession. But she decided to give more time to this foundation, which has been formed 2 years ago, and this is their second annual gala. Rubina, we welcome you. And let's hear from you why this was so important for you to give more time to this noble cause. You could have really made fortunes by your own profession.
Well, I'm of Indian descent. And being Indian, I know and I have learned that I'm uniquely at risk for cardiovascular diseases. So for me, this is a personal cause. A couple of years ago, my dad had a massive heart attack, and he was somebody who led a perfect life in the sense that he always ate clean, he would do yoga for an hour, never smoked, barely drank, but he still had a heart attack. And to me, that was eye-opening because I could have never thought in a million years it would happen to my dad. He's okay now, but it got me thinking, and it got me realizing that I need to understand why, being an Indian, we are at a higher risk.
Billion plus people will be watching this. वो जानना चाहते हैं कि आपने इतना noble cause, हम लोग क्यों इतने risk में हैं जो people from Indian origin, people from South Asia?
A big part of our risk is hereditary. And I think this part I will pass it on to Paul, because he's a cardiologist and he can explain better than myself why Indians are uniquely at risk.
So let's get to Dr. Paul. Why are we different?
We're different. Differences in healthcare equals differences in genetic predisposition. Indians have smaller blood vessels. They're more predisposed to hypertension, diabetes, that causes endothelial dysfunction leading to blockages, heart attacks, strokes, and renal failure. So I have lots of patients who are of Indian descent, and they at times are not even candidates for bypass surgery or for stents because of the size of the blood vessel. So knowing that genetic risk, you have to take care of yourself. You have to be up to date with risk factor modification. Take medications, and also dietary habits are extremely important to lower your risk of cholesterol harming you. Also diabetes and heart disease awareness as well.
As we talk, the मामला तो दिल का है. It is a matter of heart. HDL and LDL. You know, we people just like we are going to the temples here and even back home in India, our food. So how can they, like what you being a physician and the specialist from the Dilka doctor, I'm going to say because we never used to feel that but this is alarming. As Rubina did mention, uncle was living a very healthy life, but all of a sudden, like, you just see that this is coming. So what all they can do as in precautions, you being a physician, your message to the people of Indian diaspora in India?
Number one is know your risk. Know the fact that cholesterol is important to heart health. We have to modify those risks. You want a total cholesterol of less than 200, LDL preferably 70 or less, and HDL above 45, 50. If you have risk, address them. Go to your doctor. Describe to them your symptoms. Do not ignore your symptoms of fatigue, shortness of breath. Don't wait for chest pain, because Indians, women, don't have chest pain with a heart attack. It may be just fatigue and shortness of breath without a good reason.
Dr. Paul, let's get to some very basic points. What, like a person who's very normal, he or she feels himself. We do know, we have one of our colleagues, he was from NBC, they did all his tests, and the next morning they find him, he's not even there on his desk itself. In many more cases, we just recently had somebody, he was 40 years old, so young, he doesn't see any morning.
It's unfortunate. I always emphasize that you need to know the patient first. Testing doesn't save lives. Knowing the patient. A normal stress test may only be as good as 90%. We do miss 10%. And I strongly feel in the Indian community, the 10% is where you have to really understand your risk. Ask your doctor. As you know, it's a silent killer. You don't have to have symptoms. My father-in-law had normal stress tests, but I knew him. I know him. I know his symptoms. So when there was no reason for fatigue, an angiogram showed multi-vessel disease requiring bypass surgery. So at the end, know your patient, and please make sure that you seek medical advice with doctors who will listen to your symptoms.
Would you please share about this foundation, how this is going to be helping people?
So SCARF, Sudden Cardiac Death Awareness Research Foundation. We started this foundation a few years ago, and in response to an overwhelming need for education and awareness, because thousands and thousands of people die suddenly. All those examples that you mentioned, people just, a 45-year-old just dropped dead, somebody just died. There is a Bollywood actress who recently died suddenly, and this is all related to sudden cardiac death. Well, in the US alone, 500,000 people die. In India, how many more? So this foundation is very important. My own sister unfortunately died 2 years ago, suddenly from sudden cardiac death. And our mission has never been more clear. It has never been more important and more urgent. So our foundation is there to spread knowledge, spread awareness. We are looking to place AEDs, the defibrillators, the device that shocks you out of cardiac arrest, in all places where people gather. And we're looking to educate people. We want them to get comfortable. We want to start the dialogue. Being here, being able to talk to you, hopefully there is somebody out there that our message will help them. Maybe somebody out there will go to their doctor and say, "Doctor, I'm not feeling well. I'm not willing to take the fact that, hey, I'm old and which is why I'm not feeling well, or I'm overweight. I need you to give me some answers." And that's what we are hoping.
Thank you so very much for your precious time. And I think mission is very nice and the objective also is very humble. Only few people, they decide to give it back to the community. You are the two. And those who are watching, don't take things very easy. Make sure you take charge of yourself. Thank you very much.
Thank you
Thank
so
you
much.
so
Madam.
much for this opportunity.